Hello, I'm Amy McMillin, the owner of Custom Care Rehab Concierge Physical Therapy in Northeast Ohio, where we deliver physical therapy and wellness directly to your doorstep. And I am here today with Dr. Crystal Lantz Degeorge, owner of CLD Concierge Medicine in Solon, Ohio. She's a primary care physician who specializes in disease prevention for clients, is a compassionate doctor, and a respected leader in her industry. So thank you for joining me today and taking the time to speak to my community. So welcome, Dr. Lantz Degeorge.
Thank you, Amy. Thanks for having me.
Absolutely. So just to start, can you kind of introduce yourself and share a little bit about your background in women's health and cardiology? Because we are going to be talking about hormones and heart health.
I love it. That's like such a great topic. So thanks again for having me. But yeah, I'm a primary care doctor. I'm a general internist. I started practice following completion of all my training July 1st of 2014, and I practiced there until May 17th of 2024. So almost 10 years. I was employed with university hospitals and I practiced in South Euclid. And then in May of 2024, so about almost a year ago, I started my own practice, which is kind of concierge style, direct primary care in Solon. And yeah, I think my practice has always been probably 75% female, 75-25. So I see men too. But because I think women do often prefer a female physician, my practice always skewed a little bit that way. With regard to cardiology, I mean, just to say like what is a primary care doctor? I mean, well, of course, it's the person you go to with everything, and I help you navigate the system and hopefully take can do 90% of it, but engage specialists when needed, of course. But the other role of a primary care doctor is prevention, right? It's like threading that needle of like, what interventions are we going to do to make your medical life as uneventful as possible is my goal. And because heart disease like is still the number one killer of people in our country, including women, it still exceeds cancer in terms of deaths per year. Preventive cardiology is a big deal. Like, what am I going to do to prevent heart disease, strokes, and kind of all of that? And obviously, there's a balance, right, between the medications I would prescribe, well, starting with the testing I would offer, the medications I would prescribe, and like all the lifestyle stuff that I would counsel on. So, my goal is to function kind of the way a preventive cardiologist would. So, hopefully, you never have to see a cardiologist. So, yeah.
Yeah, so yeah, that makes sense. Yeah, so I love that we're talking about this since a good portion of your practice is female, but yes, also anything that you want to speak to specifically for more hormonal health for men, let's talk about it as well. But
Sure.
why is it important? I think the discussion that I have with my clients that we're finding education coming up is I didn't realize there was such a large component to hormones to heart health. Like, why all of a sudden, now that I'm 42, is my cholesterol climbing when I have
Yeah.
not changed anything in my diet? Why is that?
Right. Yeah. Oh, I mean, that's like such a good point and like something, we see all the time. And there's like a whole science behind all of this. Um, Estrogen, the hormone that women's ovaries make, is protective against heart disease. It does this in a ton of ways, which we can get into more. But it's heart protective in a ton of different ways. And when your estrogen levels start to decline in the perimenopause to menopause transition, you do see all those things start to happen. The cholesterol numbers creeping up, the blood pressure going up. None of these so much that a doctor is telling you to go on medications for them, but they're just like interesting, right? Like you were always complimented on your cholesterol or blood pressure, and now it's not quite so good. And it's because the estrogen levels are now fluctuating. And
Mhm.
then in your later 40s and early 50s, now they're getting really, really low. So estrogen has this like wonderful protective benefit on hearts. That's why women don't have heart disease until about 10 years later than men do. It's why they don't have heart attacks or sudden cardiac death even until like 20 years later than men do because they have estrogen longer. So there's like such an important role of estrogen for heart health,
Mhm.
but it's also like a really important thing to understand. And what's so interesting is that and I'll make this point like again and again throughout our interview, estrogen, like if you were to start hormone replacement therapy and give yourself more estrogen early, like in your 40s and 50s,
Okay.
before cholesterol has built up in the heart,
Mhm.
it has a very protective benefit on future heart disease risk. But if hormone replacement therapy is started later, once cholesterol has already built up in the heart,
Mhm.
it doesn't have a protective benefit. It can actually even be somewhat harmful. This in no way means that a woman in her 60s couldn't start hormone replacement therapy, but like it's super important to understand the distinction that when started later, it doesn't have the same protective benefit and in fact could be potentially harmful. Again, doesn't mean we can't, but like that's the important thing, I think, that the timing of when you start hormone replacement therapy when it comes to the heart, not the
Mhm.
other stuff, like the bones
Yeah.
and the brain, like you'll always get those benefits, but when it comes to the heart, the timing is so important.
Interesting. Okay, so that number again was like in our 40s because
Well,
Perry.
yeah. So not everybody needs to start hormone replacement in their 40s. The average age when menopause happens, so like periods stop,
Mhm.
is 51. The magic number, we think, when estrogen won't have a heart protective benefit anymore is about 60. So we think that women who start HRT after 60 are not going to see the same cardiovascular protection that they would have if they had started it earlier.
Okay. In their 40s, 50s, depending. And of course, that obviously so many considerations, but including maybe your family history. If you have a high family history of heart disease, maybe we're having that discussion earlier.
Well, yeah, I think that's like the goal of a good primary care doctor, right? Is like none of this is one size fits all.
Yeah.
You might have someone who has this rip-roaring family history of heart disease, and then you're gonna really be thinking about estrogen sooner. Or you might have a 65-year-old who is really healthy, and you do your appropriate screening for heart disease, and it seems like they're low risk, yet they're having all these menopausal symptoms, and just they haven't found the doctor yet who's offered them HRT. Does that mean that they can't? No. It just means that like it colors the discussion that you're going to have with that woman about what the benefits of HRT are and what the risks are.
Okay. Well, let's talk a little bit about some of those early warning signs that you
Totally.
have heart health issues or that your hormones might be playing a part in your heart health issues. What kind of symptoms are we looking for?
Sure. So, like, I think first and foremost, like, the reason heart disease is a silent killer is like there may not be any warning signs. Like, what's happening to our hearts throughout our lives isn't stuff that can be really seen or felt, or even diagnostically sometimes
Mm.
figured out, although like that technology has gotten better, which we can talk about too. Um, but I think first what you said, like my blood pressure is a little bit higher than it used to be. My cholesterol numbers are a little higher than they used to be. Not to the point that someone's like making me go on meds, but they just don't seem the same as they once were. And that all makes total sense. Estrogen relaxes blood vessels, so it lowers blood pressure.
Mhm.
Estrogen reduces cholesterol. Estrogen keeps the lining of blood vessels healthy. So whatever cholesterol is there doesn't attach as well. So it all
Mhm.
makes total sense that like that these subtle changes would happen around perimenopause to menopause. The thing that women sometimes notice, this would be like the only real thing I think, besides those kind of cholesterol and blood pressure things. Sometimes women will notice around perimenopause, like an increased awareness of their heartbeat or
Mhm.
like palpitation kind of
Okay.
symptoms. This is related to fluctuating estrogen levels, we think. Sometimes women will say that the palpitations are worse at night when,
Okay.
interestingly, like estrogen is the lowest.
Mm.
So certainly that's like one thing that could like implicate that estrogen's having like the fluctuations in it in perimenopause and then the deficiency of it in menopause is having an effect on the heart. But the other
Yeah.
stuff would be those little subtle changes in BP and cholesterol.
Okay. And that's, I think, so important to know because I've had so many women, so many clients and friends saying, my doctor saw that my blood pressure was getting a little elevated and my cholesterol. So they put me on a statin and a blood pressure medicine. Oh, who would have thought that maybe it's estrogen and we don't need those medications? Maybe we need hormones because that has hormone replacement therapy, because that could actually not be a Band-Aid, but a fix.
Oh, 100%. And I could go on and on. Like I went to
Yeah.
medical school in 2006 to 2010 when HRT was still kind of like a no-no, and you got all of about an hour of lecture on menopause, right? So, I mean, I went into practice in 2014. Yeah, absolutely.
Yeah.
Like, or everything else, like anxiety. So put on an antidepressant, or focus issues. So put on a stimulant, and like and I was doing all of that too, and things got a little bit better, but not like all the way better. And it was only like as I got, more into my career, and took some of this education on to realize like, yeah, like this whole time, like a little packet of estrogen gel, once daily would
Mhm.
have gotten to the root of the problem, and then said patient wouldn't have been on 4 different medications.
Yeah.
So that's totally, totally accurate for a large percentage of
Yeah.
patients.
And we are still trying to catch up with that science. So let's skip ahead just a little bit. Can we talk? Because I hear a lot about this. I don't want to be on hormone replacement therapy because I don't think it's necessary. I have as much as I need, and it's just a normal thing that's happening in my body. What are the common myths or misconceptions that we hear about hormone replacement therapy that you want to address?
Well, I mean, I think there's so many misconceptions, because there's been so much conflicting information. Like in the 80s, all women were on hormones, not even if they didn't have symptoms. It was all for this like preventive kind of benefit.
Mhm.
And then in the 2000s, when this big study came out that kind of showed increased risks of things like blood clots, stroke, and breast cancers, as well as endometrial cancers, everyone was taken off their hormones. And then those studies were looked at again, and they were found to be really faulty, and that the risks that they were kind of purporting were like very small and less than the risks of, say, like a glass of wine a day, so
Okay.
I think there's been so much confusion over all of this kind of stuff. Now, that said, it's still an individualized thing.
Mhm.
I personally do not practice in a way, and I don't think most doctors do, that would do HRT like purely for the long range benefits. We may move that way, but I don't think we have yet.
Mhm.
So I think as a clinician, you want to see, you want to screen for like the symptoms of
Mhm.
low estrogen, right? Which are interesting. It's not just like hot flashes and night sweats. That's like another misconception. Well, I'm not having hot flashes or night sweats, so I don't need it. It's like brain fog,
Mhm.
trouble sleeping, like a harder to control like mood,
Mhm.
focus issues, like you're getting diagnosed with ADHD suddenly in your 40s when you didn't have ADHD before, right? Like it's that kind of stuff. Oh my God, it's like joint pain. I've had women who have, like PT, right? Like
Frozen
so really
shoulder.
bad shoulder pain, frozen shoulder. Some of them have even had like arthroscopic shoulder surgeries that didn't
Mhm.
work. And then they go on estrogen and their shoulder pain goes away. Like I just saw one of them yesterday. So like joint pains. So there's so many more symptoms than I think we were taught. And if we're
Mhm.
not having the classic ones we were taught of, then we don't need it. That would be like one point I would make. And also like the misconception that like what are the preventive benefits we don't talk about enough? Like we got so hung up on this like breast cancer thing, which like if I put 10,000 women on hormone replacement therapy, I'll see 4 more early stage breast cancers like in their whole lives, like 4 in 10,000. But like we didn't talk about like the 36% reduced rate of colon cancer, which is I think the real scary one right now. And we didn't talk about dementia and like why are there so many women in their early 80s getting dementia right now? And there's so little we can do about it. Probably because they weren't on estrogen. Like I really think like that's a misconception too, that there's not more long-term benefits than the ones we knew about. Certainly the bones, my God, the brain, the heart, which is the main focus of our discussion, colon cancer, that kind of stuff.
Great. And the more we talk about it like this is a great discussion, that we are just spreading that word in the education of how to
Yeah.
advocate for ourselves and what those symptoms look like.
Totally, 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 totally. And there's clinicians, both physicians, nurse practitioners, et cetera, who've done tons of training on this, and like their mission is to spread the word. This is
Yeah.
a small part of what I do as a PCP, but I love it because as a PCP, I can do all of this kind of stuff too, and then not have to, like what you said, the statin, the blood pressure pill. Not
Yeah.
always. Some people, yes. Some people do need all of those things for
Yeah.
sure, but not all the time.
Yeah, and it's nice as a PCP that you are educated and well versed, so we don't have to go out to a specialist, that you know what you're looking for. So you're just very unique is all I want to say, and
Well,
what
thank
you
you.
and what you can do. So let's go back to our heart health. What tests and diagnostics should we be talking about with our doctor to say,
Yeah.
all right,
Yeah.
my cholesterol's up, blood pressure's up, some palpitations. I'm 40 some years old, 50, 60. What tests are we doing to find out how our heart is?
The big one nowadays that I would like really kind of hammer home is calcium scoring. So
Okay.
you would ask for a calcium score. It's been around for 10 years.
Mhm.
It's getting much more popular. Um, what the test is. So it's just like a 2 or 3 minute long CAT scan. So that's like big wide open, not like an MRI claustrophobic. There's no IVs like or pokes or anything. It's just a CAT scan that's quick. And what it's doing, this imaging technology, is looking at the four main arteries in your heart and it's quantifying how much, if any, cholesterol buildup has built up in those arteries. And it gives you like a numerical score. With that numerical score, we can like plug it in a calculator, like compare to other people, your gender and your age, and kind of see how you fall. And it's really useful in making some of these treatment decisions. When we talked about like the timing of estrogen, like going on HRT sooner rather than later for the heart health benefits, there's going to be a ton of patients who get a score of 0. Like, and that's really reassuring that like that damage to blood vessels hasn't happened yet. Those would be perfect people for HRT from a heart prevention standpoint. If you
Okay.
have someone who's a little bit older and you're a little bit worried, you can still get that test and kind of screen in a better way for what their future risk of heart disease is, to kind of elaborate on your discussion of HRT for them. Again, not saying they shouldn't do it, but you know, the discussion is changed a little bit. And I would say men at 40 and women at 45 is a really good time to do a calcium score. I think sooner if they have a strong family history, like family history, we think, did people in your family tree have heart attacks or strokes in their 50s or 60s? And if that was the case, I would do it sooner. But usually 40 for men, 45 for women, could be a little bit earlier. So calcium score would be a really good thing in addition to what you're hopefully normally doing, which is good quality blood pressure checking, and then those blood tests once a year, doing that kind of cholesterol screening blood test once a year with your PCP.
Okay, perfect. What current options are there for hormone replacement therapy that we can speak to?
Oh, good question. So your ovaries make three hormones: estrogen, progesterone, and testosterone. We'll talk mostly about estrogen and progesterone because those are the big ones. And estrogen really is the biggest one. Estrogen is what protects against heart disease, brain function, like cognitive function. It's what maintains bone strength. It's what regulates your mood. If you are having hot flashes and dry, or vaginal dryness, it's what's going to fix it. So estrogen is like the big one.
Okay.
Progesterone is used because if you have a uterus, like you haven't had a hysterectomy, and you don't have an IUD, because if you had an IUD, you wouldn't need progesterone. So if you have a uterus and you don't have an IUD, you need progesterone to balance your estrogen. Because if you just did estrogen without the balancing progesterone, the uterine lining would overgrow and you would be at high risk for uterine cancer. So those are kind of how the two hormones work. Estrogen is like your big bang for your buck. Progesterone is absolutely needed from safety's sake.
Okay.
It does a little bit for sleep a lot of the time. Testosterone, sometimes the cherry on top for energy and libido, but not everyone needs testosterone. So what are the options? So estrogen is either a pill or through
Mhm.
the skin. And if it's through the skin, it's in like a patch or a gel or even like a vaginal ring that could get absorbed
Okay.
vaginally. But patches and gels are probably the most common, or pill. Progesterone, some compounding places will do through a cream. What we know is that progesterone is like a really big molecule that isn't absorbed well through the skin. And you may not be having like the safety benefit that you need when you do it through the skin. So my practice would only be to do progesterone orally. Now, there's some
Okay.
creative things you can do with progesterone pills, but generally progesterone in a pill, estrogen through the skin through a patch or gel or through a pill. The big important thing is when estrogen's done through the skin, that little risk of blood clots that you have when you take it through a pill is way reduced. So
Okay.
I strongly prefer estrogen through a patch or a gel and progesterone through a pill. And that's kind of like the safe way to do it, I think.
Hmm.
Now,
Okay.
there were other options. Like some women out there may have been offered compounding creams or even like implanted pellets. And it's not their fault. There was this whole period of time when they couldn't find a doctor who knew about hormones enough to, or was unwilling to prescribe them. So they turned to kind of some of these like more alternative practices. So it's not their fault. This could lead into like a whole discussion of like bioidentical and what that means. Um, but I wouldn't recommend those kinds of ways to deliver hormones for a variety of safety reasons.
Okay. Yeah. We'll maybe have to do another discussion about bioidentical pellets and that and
Yeah.
FDA
Don't do it.
regulation.
Go to a doctor, get them through the pharmacy. Like that's the basic thing. It was a marketing tool.
Yeah.
95 times out of 100 that I prescribe HRT to a woman and they go to CVS to get it, it's bioidentical. It's the same
Mhm.
molecular structure as what their body's making hormone wise. So that was a marketing tool. You can get bioidentical hormones traditionally in an FDA regulated way.
Okay. Really quick about ages, because I get this question a lot. I know estrogen after like menopause might not have the heart protective, but a lot of women are like, I am menopausal. There's no point in me taking hormones. What can postmenopausal women do, even if it's not heart protective per se?
And that's like the point I want to make is like for purposes of the heart, you did miss your window for protection, and there should be a discussion about the small risks, but there's no age that's too late to start hormone replacement. And like I love starting hormone replacement in people, who are older because they see it's like, they see the benefit much quicker and much more like obviously. And I'm so happy that their quality of life has substantially improved. So there's no age that's too late. They absolutely can start it. They will not have hot flashes, not have night sweats. They'll have improvement in cognitive function and mood, and joint pains. And for all those reasons, they totally should start it. The brain benefit and the bone benefit will still be there. It's just they should be screened for heart disease before starting it.
All right, that's great information. Yeah, because I know so many women who are like, I'm done, I'm postmenopausal, I don't need anything. And that's so great to just drive that point home. So, let's talk at Custom Care Rehab. We actually have like a stress management and exercise program that addresses lifestyle changes that people can
Yeah.
implement to protect their heart health. So it
Yeah.
includes like sleep, hydration, personalized exercise, nutritional advice, stress management practices. Are these strategies important for people to implement for heart health, or should they just rely on hormone therapy?
No, I mean everything you said, like that's like everything, right? Like, um, I always say, like, making time to work out or like figure out my stress, sometimes with like a therapist, drinking water, eating whole foods rather than processed. Like all of that stuff is hard. But like feeling crappy and being on a bunch of prescription meds with side effects or being overweight or in pain is harder. So like choose
Yeah.
your hard. So like that stuff is everything. Like if we can figure out how to incorporate that stuff into our lifestyles, um, everything changes. All of those risk factors dramatically are reduced and everything else gets better. It becomes like this cascade effect. So that stuff is like everything. Um, there are patients who do all of that, and I can tell that due to probably genetic bad luck, they do need prescription medications. Usually those people who are doing all that are the ones who want to go on prescriptions like the least, and I get it, but hopefully I can, get them eventually to trust me and I can pride myself on knowing like who those people are. So like I think ideally like you do all of that kind of stuff and like see what you're left with. Like if you're still left with symptoms that are bothersome, or your doctor still thinks that from a preventive standpoint, you need something like a cholesterol medication, or from a lifestyle standpoint, you still need HRT, then do that. But I guarantee you it will work better at a lower dose than it would have, like if you weren't doing all of those things.
Okay. So I had kind of closing thoughts. We had one question that did come in during our interview. This particular person was asking about more holistic measures for heart health, different things that you can do, specifically beet powder. So, have you heard of anything about beet powder and heart health and
Yeah,
circulation?
I have actually. It seems like in some people, beet powders and like beet extracts reduce blood pressure. It seems like that's the only thing that they do. So like I think if you're someone who's like teetering on the border of like blood pressure, med or not, and you add some kind of beet product to your lifestyle, you're
Okay.
gonna see a decrease in blood pressure. But all the other stuff we talked about, like the healthiness of your blood vessels and the pumping of your heart and cholesterol buildup, like I don't think beet in any form has been shown to have positive effects on that, but it does seem to have like a subtle blood pressure lowering benefit.
Okay. So just talk with your doctor and take notes about your blood pressure and
I
see
think so. It's like one of the big risk factors, obviously. But yeah, just one thing.
Okay. So, any advice you can give to women in their 30s, 40s, and beyond about maintaining heart health? What do I need to
I
know in my 30s? What do I
I
need to know
know.
in my 40s?
I
Yeah.
know, I love that. I think my advice is like take your 30s and 40s to like reflect on all the things you said that you do in your preventive program. Like if you're having trouble with sleep, trying to figure that out. If you're like force yourself to drink water. 2.5 hours a week of exercise. So I always say 150 minutes, 2.5 hours a week. Prioritize that the same way you're prioritizing your work and your parenting. Like, I wish
Yeah.
I would have just force yourself two and a half
Mhm.
hours a week of exercise, drink the water, try to focus on whole foods for the most part. Um, and think about what's going on with your sleep and how you might fix it. If
Okay.
you do all of that stuff and you're still really stressed out, explore therapy to kind of like focus on stress management. And if all of that you're like doing and you're still having symptoms, by all means, like let's try to improve your quality of life with medication. Like that's the advice I would give. And like find a doctor who you can trust, easier said than done, but someone who you can trust, who is smart about all of this kind of stuff, will meet you where you're at. Um, that's I think the advice I would give.
Okay. So, where can people, women, find a little bit more trusted information and resources? Because
Yeah.
TikTok and Instagram sometimes aren't the most reliable sources. So, where should we be headed? Reliable sources for information.
Sure. Well, with regard to menopause and hormones, there's two societies that you should Google
Okay.
that have really good websites, and that's the Menopause Society and the North American Menopause Society. North American Menopause Society is NAMS, and then just the Menopause Society. They both do a really good job of two things. One is like putting out patient education that's legit and evidence-based and current. And then the other thing that they do, which is kind of nice, is like if you're struggling to find a provider, there are providers who are like registered with those societies that have done the extra training and things like that. And you can find providers like that. Now, a ton of PCPs, myself included, may not be on that website. So if your PCP is like has a good handle on it, great. But if you're struggling to find someone, like I think the repositories of providers on those websites can be a good place to start.
Okay, great. So thank you so much for your time. I think this was a fabulous discussion. Can you just kind of recap and tell everybody where they can find you, your website, and then
Oh,
I will put all of that in the show notes, so people can link to you directly. So,
totally. Oh, yeah. So I have a website which is www.cld, like my initials, cldmd.com. So cldmd.com is my website. You can certainly reach out to me through there. You can schedule a 30-minute meet and greet. I'm still accepting patients on a more limited basis, but still accepting new patient referrals. So you can find me through there. And then for more information on menopause, we said the Menopause Society, the North American Menopause Society are great resources.
all right. Well, perfect. Well, thank you again, Dr. Crystal Lantz Degeorge. Thanks so much for your
Hey, Amy.
time. Until
Oh my
next
God,
time,
it was a
everybody.
pleasure.